Assalamu alaikum warahmatullahi wabarakatuh.
Alaikum assalam wa barakatuh.
Ní àwọn àgbà wọn ní kí àgbàdo tó dé ayé pé kankan ni adìyẹ tí ló ń jẹ. Ìbéèrè tẹ́ béèrè yẹn ó wà very very germane and important. Ìbéèrè onídàá olójú méjì ni. Bẹ́ẹ̀ ni tí ẹ bá rántí láyé àtijọ́ rate tí àwọn ọmọ fi máa ń kú pípípí ó pọ̀ tí wọ́n máa pé àbíkú ni ìyá ìkúlé ni ìyá ọ̀kan ni àjẹ́kí lánàá ọmọ kú lónìí àbí but that rate has reduced àbí so yẹn ti reduce gan so ìkan tó mì ní pé in those days knowledge wa ò tó ẹni mélòó ló ń ṣẹ́ẹ̀kì ìfúnpá kí lè fẹ́ fi ṣẹ́ẹ̀kẹ́ nǹkan tẹ́ ẹ̀ bá dẹ̀ wá ẹ̀ lè rí ìyẹn tún lọ báyà bí then ayé tí wàá lajú nísìnyí o I mentioned some of those things tá a máa ń ṣe imported baked food baked beans fried this imported that òun la fẹ́ jẹ àbí these fresh fruits vegetables pọ́pọ́ tó wọ́n á já gbogbo ẹ̀ tí wọ́n á jẹ tó bá fẹ́ jẹ ewédú wọn lọ kò sí ìta fi chemical fertilizer gbé o all those things ó wà ń bẹ àbí then jẹ natural things mọ́ there is what they call this organic and non-organic food non-organic la ń jẹ o tó jẹ́ pé within 7 days wọ́n á hash ẹyin á dẹ̀ di chicken ńlá tàdé máa jẹ and we think it's healthy enough is that not chemical? ṣé láyé ìgbà yẹn irúkọ́ làwọn ọmọ mi wá ń ṣe ni wọ́n ń jẹ ni àbáwọn bàbá wa ẹni mélòó ló ń jẹ magi a dẹ̀ sọ pé ìdìbò tó fi ń jẹ magi ló fi ń jẹ yọ ẹ ti rí bẹ́ẹ̀ àbí so gbogbo ẹ̀ so that's why I said is then other things sí wọ́n sọ pé ṣé ìwé àti egbò òṣìṣẹ́ àbí ìwé àbí tablet ni òṣìṣẹ́ let me say this it's as a result of research any drug tẹ́ bá rí extract from herbs tested now with other things okay kí ni quantity tí ò ní affect human being are you getting my point so it's not from tó jẹ́ pé okay if I do this I do that no it's research àwọn ewé yẹn ni let me add to that in those days when we were young ewé dóngóyárò la máa ń lò nílé tá a máa ń mu ewé yẹn dẹ̀ kóró bíi tó ní ewé dóngóyárò yẹn pé kò ṣiṣẹ́ mọ́ pé àwọn ayé ti tójú bọ̀ bó ti gbà bọ̀dì because that's the only explanation tí wọ́n lè ṣe but research shows that it is hepatotoxic it has effect on the liver but wisdom bàbá wa ni pé ó ti gbà bọ̀dì ayé ti tójú bọ̀ are you getting my point so it's research mi mọ̀ bóyá mo ti.
bẹ́ẹ̀ aláwọn nǹkan yẹn ọ̀fà ni o ẹ̀wọ̀n ní kò tó wà ní tó ń jẹ́ ọ̀fà àfọwọ́fà ọlọ́run yóò kàn wá lọ́wọ́ so now oníbèrè béèrè pé ẹ̀jọ̀ kí ló máa ń fa erectile dysfunction in a man after he has given birth wọ́n ní kí ni ìmọ̀ràn yín fún irú ẹni bẹ́ẹ̀ àwọn ìgbésẹ̀ wo ló lè gbé láti correct ẹ̀.
okay.
now kí nǹkan ọmọkùnrin ọmọ ṣe ségesège lẹ́yìn ìgbà tó ti bímọ tán ẹ̀wọ̀n ní kí ló máa ń fà á.
nǹkan tó ń fa ọ̀pọ̀ púpọ̀ ara risk factor hypertension tá a sọ ó máa ń fa which is stress economic situation of today is stressful enough kò ní gbórí ìwọ tó ń ro pé báwo lọmọ sí báwo ní báwo fẹ́ sanwó school báwo fẹ́ ṣe lé báwo fẹ́ ṣe lé wọ́n àná òórùn sùn oúnjẹ ò sí lára ìwọ̀n tí kò lè wọ́n nínú dídùn ló mórí yá wa. That's one. Then two is that ati take our for granted. Ṣé bí umu ni, ṣé babu ni, and naturally there must be play foreplay, things like that. But baby umu ni, ṣé babu ni. So all those àwọn eré tá à ń ṣe ńgbà tá a kọ́kọ́ marry yẹn gbogbo yẹn ò sí mọ́ àti tó kíní kan bọ kíní kan lọ́wọ́ kíní kan àbí nǹkan kan so everybody is serious báyìí. So all those things, let's go back, let's do it. Then another thing is, what do we eat? Kí làwọn kan tá à ń jẹ gbogbo àwọn nonsense tá à ń sọ yìí náà that's effect ṣó ti yé wa. So mi rò pé bóyá mi ti. Then seek for medical advice. So we can't explore everything here.
Tọ́ adìyẹ tán ọlọ́run ṣe gbogbo ẹ̀ rọrùn.
Well, as moderator sọ lẹ́kan, consultation yẹn is free. You can get my number, you can get to me, we can discuss further. Thank you.
And if you do that, you won't regret. Àwọn tó ti ṣe tán ti pè wọ́n fúnra lọ́wọ́ rú nǹkan bẹ́ẹ̀ ọlọ́run ló wọ́n sábàbí dáadáa. Kéèyàn má bẹ̀rù owó but naam alhamdulillah now Abu Muhammad àtàwọn ní béèrè kí á náwó ká máa mú mọ́ra wọn.
Well, mo ti gbọ́ béèrè yẹn kí wọ́n tó béèrè so kò ní ìdíkẹ́ tó ń ṣo wọ́n ní ṣe hypertension lè fa kéèyàn máa sùn. Yes, I said it here. Ó lè fa kéèyàn máa sùn. In fact, I saw a patient today that complained nìkan náà nìyẹn pé òun sùn. When we check the blood pressure, it was very high. The meaning is that the body is doing overeating, and delay is what is dangerous. If not, stroke is coming. Well, I mentioned, let me add, I said that on my stroke on my phone, doctor nurse malabe. We have different specialty in the medical field. My own specialty is different. We are public health physicians. We tell people what to do not to get ill. That's our own. And that's the only field. Okay, prevention is better than cure. It's not like, okay, when you come to me, I want to make money, I want to do. No. I have to get to the root. Kilo fa. Are you getting my point? So that's our public health physician. They want to prevent. If you have so many hypertension outside, so many malaria outside, that means we are not doing our job and we are not happy. Thank you.
Now, wọ́n lè sọ̀rọ̀ nípa sleeping pattern. Wọ́n báwo wá ní ẹni tó yẹ pé ó máa ń lo oògùn oorun so kó tó sùn pé ó lè tètè sùn ó sì lè pẹ́.
Well, thank you very much. Ẹni tó ń lo oògùn oorun, that means pé kò ń ro oorun sùn ló ṣe ń lo oògùn oorun. Kí ló fà á tí ò fi ń ro oorun sùn? Because maybe you are just treating the symptoms. Ro oorun sùn, o dẹ̀ ń lo oògùn tó fi ń sùn. Kí ló fà á tó fi ro oorun sùn? You get the root. Kí ló fà á tó oorun yẹn ò fi wá? Ó yẹ kó oorun wá naturally. Because it's not good to be on sleeping tablet for life. If you are going to use it, you can take it for 2-3 days, maximum 5 days, and then you are okay. But perpetually, you need to seek further expert management.
No. Wọ́n ní ẹjọ́ kí ni ọ̀nà àbáyọ fún obìnrin tí ò fọmọ lọ́yàn lọ́wọ́ tí ọyàn yẹn sì ń lactate so tó ọyàn sì ń somi bí ẹni tó ń fọmọ lọ́yàn.
Thank you.
No.
It is an hormonal imbalance.
Tọ́.
The advantage of that is that irú obìnrin bẹ́ẹ̀ ò lè lóyún at that point. It's a form of family plan. Because téèyàn bá ṣe ìbímọ kò lè lóyún. That's the advantage. The disadvantage is embarrassing. So my wet láì ṣe pé kiri ṣe no. So it's hormonal imbalance and the culprit is prolactin, which is hormone tó wà necessary fún lactation kóbìnrin lè fọmọ lọ́yàn. so hormone yẹn ló high ju normal lọ. So if you seek further, they will give you drug to suppress that, and that will stop.
Now ọlọ́run máa ń lo paracetamol ní gbogbo alẹ́ pátápátá. Is there any replacement or is it dangerous? Every night, have you?
Well, it's a very common thing in this part of the world.
Okay, only paracetamol is almost every night.
It's very common in this part of the world. We believe that tabati le ṣiṣẹ́ tabati lògùn lójúmọ́ yẹn ara wa ń balẹ̀. Feel okay. So it's a kind of psychological issue. Are you getting my point? It's a form of psychological issue. If I tell you anybody tí o bá lo paracetamol yẹn oorun yẹn ò ní wá, because ó ti condition mind ẹ, so you need to unlearn and relearn and think that this one, then probably irú ẹni bẹ́ẹ̀ yẹn máa fún ní substitute nǹkan tó lè ṣe tó lè lò, because naturally lálẹ́ ni àbí tó ti jẹun tó ṣe tó bá sùn dáadáa you be okay, but such person can consult further, can consult me free of charge. So we can change the orientation to something that's tí wọ́n máa fi sùn but tí ò ní jẹ́ everyday. Everyday is not good. Paracetamol is equally dangerous. Paracetamol is dangerous. But the only advantage ta ní níbí ni pé paracetamol tó ń pè é ọkọ ní 500 milligram most times bóyá 200 ló wà ń bẹ̀ bóyá 300 ló wà ń bẹ̀. So some of us take more than that, more than 2. That's when you travel outside you take paracetamol ẹyọkan àbí méjì wọn pé oògùn yìí ṣiṣẹ́ gan because ìkan tí wọ́n ló wà ń bẹ̀ ló wà ń bẹ̀. Are you getting my point? The milligram tí wọ́n ló wà ń bẹ̀ is what is there. Tẹ́ bá lo mẹ́rin yẹn èèyàn lè kú because ó lè burst the liver. As simple as 30 paracetamol, if you take about 4 tablets of paracetamol ó lè pààyàn. Yes, paracetamol at a time. But I know some of us here àwọn à ń lò. We are lucky that paracetamol tó ń pè 500 yẹn kò tó 500. Tó bá pé 500 ni.
Tó lọ ṣàánú wa. Wọ́n ní ẹjọ́ báwo ni obìnrin tí ó ń fọmọ lọ́yàn lọ báwo ló ṣe fẹ́ maintain sleeping pattern?
Ìyẹn ló simple jù. Ọmọ tẹ́ ẹ̀ fún lọ́yàn ó máa sùn. Tẹ́ ẹ bá fún ọmọ lọ́yàn bó ṣe yẹ kẹ́ ẹ fún ọmọ lọ́yàn ó máa sùn minimum of 2 to 3 hours tó bá mu yàn tán. Ẹ̀bọ̀n tó mọ́ bá mu yàn dáadáa tó bá ṣe ó máa ṣọwọ́ kejì báyìí fún mọ́mí ẹ̀. Mọ́mí mi ò wá pẹ́ láyé, mọ́mí mi ò wá jẹun ọmọ, wọ́n ṣe máa ṣe bẹ́ẹ̀. So ẹsẹ̀ ọwọ́ kejì yẹn ó máa gbé sẹ́yìn mọ́mí ẹ̀ báyìí ó máa fọwọ́ gbé mọ́mí. Ṣé you understand? So at that time tọmọ yẹn bá mu yàn dáadáa tó bá sùn, you too supposed to sleep. Tọmọ yẹn bá tún jí ẹ tún jọ jí, tó bá tún sùn ẹ jọ sùn, tó bá ti jí ẹ jọ jí, tó bá sùn you have minimum of 6 hours. Because that is over periodic now for that period abi ó simple bàjẹ́. But most times time tí ọmọ yẹn bá sùn òun la máa ṣiṣẹ́ tá a máa ṣe eré máa ṣe lé so gbàtọ́ bọ́ bá tún jí wàhálà tún dé. Then lastly, most of us are ọmọ bí wọ́n ṣe ń fọmọ lọ́yàn. I'm sorry to say it. Please, when you get to the center, let them teach you how to breastfeed. There is a pattern. Yorùbá will say ká gbọ́ ọmọ fọyàn ká gbọ́yàn fọmọ kankan náà ni. It's not the same. Yes, it's not. It's that you ẹ gbọ́dọ̀ gbé ọmọ fún ọyàn ni. For instance, you want to breastfeed. If you want to breastfeed ọmọ, ẹ máa gbé ọwọ́ eléyìí, ẹ máa fi gbé ìdí ọmọ báyìí. Ọwọ́ yẹn ó wà báyìí, so ọrùn ọmọ máa wà báyìí. Are you getting? Ọmọ ni mo gbé yìí o. So ọmọ tẹ́ ẹ gbé yẹn, you can move this baby anyhow, like this. So you can sit anyhow, cross leg, rest your seat, put that baby to the breast. You can relax. Are you getting my point? Put the baby to the breast, not the breast to the baby.
by the time you relax like this and tọmọ yẹn bá tó bá muyàn tó bá yó wàá lọ gbé sílẹ̀ but most times nǹkan tá a máa ń ṣe ni pé a máa ń gbé ọyàn fọmọ ni so we now do like this within 20-30 minutes ọrùn tí ń ro wá ẹ̀yìn tí ń ro wá o má pa mí jáde ayọ̀ agbọmọ so we not rest that's why I'm sorry to say that mo mo ṣe ń fọmọ lọ́yàn kíkọ ẹ̀kọ́ dẹ̀ ní nǹkan tí wọ́n bá kọ́ èèyàn mọ̀.
So Ashekini, you are not sorry to say you said it well, so jazakumullahu khairan. Mo rò pé a ti gbọ́ yé kò tí ì létí o ọlọ́run fi baraka sí náà wọ́n ní kí ni àwọn nǹkan tó máa ń fa kí àyà máa ròyàn àti kí ni solution for inadequate appetite.
Well, àyà ríro we have so many things ó lè fà in fact tí blood pressure bá lọ sókè ó lè fa àyà ríro then which part of the àyà ló ń ròyàn if you have ulcer ó lè fa àyà ríro so many things so and that's why doctors are not magicians ẹ pé àyà ro mí ok ìgbà wo ló bẹ̀rẹ̀ àsìkò ló máa ń bẹ̀rẹ̀ ṣó máa ń jẹ́ ẹlẹ́ lóru so ó ní nǹkan tá à ń fẹ́ fàyọ̀ ń bẹ̀ we are doing substitution and elimination ok kò jẹ́ ẹlẹ́ lóru kò lè jẹ́ lẹ́yìn ok ó jẹ́ ok ó lè jẹ́ lẹ́yìn so by the time you know because you have 1001 things tó lè fà so you now reduce it ok go and do this 1-2 tests so just to confirm are you getting my point ẹni táyà ń ro yẹn ṣó máa ń tètè ń jẹun because bóyá bóyá ọ̀sà ni so then ẹni ẹ lóun oúnjẹ jẹun inadequate appetite mo rò pé yẹn ló yẹ kó wà happy because bí nàìjíríà ṣe rí gan-an kéèyàn happy pé òun ò tẹ̀kú tí ẹ̀ lè jẹ oúnjẹ púpọ̀ tẹ́lẹ̀ nígbà tó jẹ́ tiwọn but that's just on a lighter mood so àìjẹun yẹn must be as a result of something there must be an underlying factor so kí ni nǹkan tó ń fà ṣé nìyẹn ṣé nǹkan tó ń jẹ ní orí tí ò lè jẹ ni àbí nǹkan tó wà available. Hello? So let's look at that. The person should consult because it's dangerous. If you don't eat well and you don't eat on time, and collect see ulcer here, and you still be nursing that. So it's better to prevent it from happening. Thank you.
Ní ẹjọ́ sí ọlẹ́ mention wípé ibuprofen and ibucap are not good for body. Èrò pé wọ́n ní kí lè fẹ́ sọ lórí kéèyàn máa fún ọmọdé bíi 6 months and above for láti máa ṣe ìtọ́jú pains because there are drugs ibuprofen for babies. So
yeah, thank you very much. It's not good. I've given us.
Not good.
Yes, I did not say ibuprofen or ibucap. They are all of them are under an umbrella called non-steroidal anti-inflammatory drugs. What I'm saying is that drug tí ó yẹ kéèyàn abuse ni because tó bá ti jẹ́ pé ó ti pọ̀ jù it can lead to hypertension in life. However, there are some disease conditions tó jẹ́ pé you still need to use it but you are using it for a medication not you are abusing it. There are two different things. Some people abuse all those like paracetamol. Some of us abuse paracetamol. We take morning, afternoon, night, morning, afternoon. Nǹkan ṣe wá nǹkan ṣe wá we take it. So gbàtó bá dé stage kan á rí pé paracetamol ṣiṣẹ́ mọ́ kí ni next one ibuprofen ibucap we take it on a regular tábà tí take it it's an addiction. It's just like some of us tábà mu soft drinks tó bá ti ṣèyàn rí if you are taking Coke Pepsi and you see that tó ń sell mi báyìí Coke àwọn tó bá mọ̀ tó bá wà addicted to it tó bá rí Coke tó ń sell mi báyìí ọkàn wọn sì máa ṣe tòló. I've passed through the stage before and alhamdulillah you understand, even if you don't see any other thing, tẹ́ bá rí coke yẹn báyìí tẹ́ bá mú you be okay. Tẹ́ bá jẹ gbogbo oúnjẹ ilé ayé tẹ́ bá ti mú coke yẹn you are not okay o. It's an addiction o. It's not easy to even, it's like ẹni tó ń mu sìgá ẹni tó ń mu títẹ̀ sọ fún pé kó filẹ̀, it's the same o. If you are taking Pepsi Coke and you find it difficult to live, it's an addiction, so don't condemn those taking other one, just pray for them.
náà wọ́n ní ìmọ̀ rìn lọ sí ibi iṣẹ́ lójoojúmọ́. náà wọ́n ní ìmọ̀ rìn lọ sí ibi iṣẹ́ ní ojoojúmọ́ wọ́n ní sáà lè pè ní stress àbí ṣé kàkà kún exercise. so kó lè mọ bí ó ṣe sọ̀rọ̀ ara ẹ̀ ní o.
Well, it depends on ibi tẹ́ ẹ rìn lọ, distance tẹ́ ẹ rìn yẹn òun ló, then àti bẹ́ẹ̀ ṣe feel ẹ̀, do you see it as a stress or as an exercise? We said that okay, if it's something you can do about three times in a week, but minimum of 30 minutes kẹrin ní kejì pé kẹ́kọ̀ọ́ rìn 30 minutes. Is it 30 minutes? Is it more than 30 minutes? So if it is getting more than necessary, you know you are stressing yourself. You too, you know. Is it because of the pocket friendly or is the exercise? But if you want to use it as a form of exercise, okay, mo fẹ́ rìn láti bí ìdè kí lorúkọ bus stop yẹn Lambe junction mi ní gbọ́kadà, mo fẹ́ rìn débẹ̀, mo mọ̀ pé within 20 minutes máa débẹ̀, exercise nìyẹn. But mo fẹ́ rìn láti bí ìdè àgbàdo, a ti mọ̀ pé circumstance ni o.
na wọ́n ní ǹjẹ́ ṣé ẹ lè recommend a female gynecologist fáwọn so tí àwọn lè báyà kẹ́ni ẹ pé yẹn.
Okay, I will work on that. I don't have anyone presently, but I will work on it. So Timothy I will get to Ben.
wọ́n ní wọ́n máa ń sọ fáwọn pé noodles ó máa ń pẹ́ kó tó digest, ó máa ń lo 2 weeks kó tó lọ lẹ́ńkùn, wọ́n ní sóòótọ́ ni.
You can answer that questions. You can answer it. I'm not here to promote anyone or promote any noodles. But what I said is that ẹ check salt content tó wà lẹ́yìn ẹ̀yìn páàkì noodles ẹ fẹ́ jẹ yẹn kẹ́ wo bí salt yẹn ṣe rí. So if it is the normal noodles tí wọ́n ṣe dáadáa tí ò ṣe adulterated quote and unquote, ẹ mọ bí tí ajá sí báyìí, so kò yẹ kí ó má digest. Then noodles, is it for ọmọ under 1 ọmọ under 6, ṣé you understand? Because some of us nǹkan tó yẹ ká fáwọn ọmọ ẹ̀jẹ̀ là ń jẹ o. There is this mìíràn tí orúkọ this powder tó máa ń fáwọn ọmọ jẹ, but when you look at it, it is meant for ọmọ tó ti ju 2 years lọ, and it's there boldly written lára ẹ̀ mìíràn tí orúkọ kí ló orúkọ yẹn, but a máa ń fún àwọn ọmọ jẹ, and naturally we supposed to observe exclusive breastfeeding, abi 6 months, abi no water, nothing, exclusive breastfeeding, ẹni kẹ́kọ̀ọ́ jẹun kẹ́ mú kẹ́ ṣe kẹ́ lè breastfeed ọmọ. But within that time now wọ́n máa fọ́mọ ní noodles, wọ́n máa po gbogbo oríṣiríṣi, so ọlọ́run aṣọ wa o.
now oníbèrè béèrè pé ọ̀rọ̀ nípa iyọ̀ pé tá a bá rí ẹni tó ti kúndùn iyọ̀ jíjẹ tí ò lè jẹun láì sí iyọ̀ ń bẹ, pé ǹjẹ́ àwọn oògùn kan lè wà tó lè máa lò tí wọ́n máa suppress tí wọ́n máa sọ iyọ̀ yẹn di nǹkan mìíràn ara ẹ̀.
Well, the same thing that's on the addiction, if you cannot control yourself, it's a choice. Hello, ẹ ti mọ ewu tó wà nínú tẹ́wọ̀n jẹ tó pọ̀. Choose between okay mo fẹ́ ní nǹkan tí ewu tó bá wá mi mind, or okay let me reduce it. I'm not saying you should stop, you can reduce it. Kí ló wà nínú yọ? I said you can do this all local ones. ginger, garlic, turmeric, crayfish, all those ones. By the time you do it, how ma take care. So you don't need to pay fẹ́ fi oògùn tó ń wo pé yọ.
náà ẹ ṣeun wọ́n ní ẹjọ́ kí ni ewu tí ń bẹ níbi ìmáàmù omi tútù àbí kí ni àwọn ìfẹ́ẹ̀tì tó ní kí wọ́n máa mu omi tútù.
Well, the best omi tó yẹ kéèyàn mu is omi tó warm. That's the best. Warm water is the best. So any other thing is your choice. But if you don't have any problem taking it, no problem.
Okay.
Etiquette. Some people, like if you're asthmatic, hello, if you're asthmatic, if you take cold, you are likely to be allergic and start sneezing and start doing that. Then even if you are asthmatic and you are in a very hot place, you can still start having that. Are you getting what I'm saying? So it's your choice. When you study yourself and say that, oh, tí bá jẹ eléyìí, tí bá mu eléyìí kò affect me, no problem, take it. But remember, excess of anything is bad. Excess, anything is bad. Hot water lọ́sàn gan is good for your health.
lọ́sàn.
Bẹ́ẹ̀ni. Hot.
Only hot, not even warm.
Warm, either warm, hot, anyhow you like it. Hot, as in my brother, you know. Yes.
Allah akbar. Sẹ́rí ọ̀rọ̀ àwọn dókítà nídìí hadith kí wọ́n tó gbà wọ́n gbọ́.
No, it's a choice.
Gbogbo wọ́n ní choice ni torí reality ni factual talk ni. So kọ́lọ̀ mọ́jà mọ̀ òdì kejì gbogbo eléyìí tí wọ́n ń sọ yìí àbí kéèyàn gbà ó. Náà wọ́n ní ẹ̀jọ̀ ṣé hypertension tẹ́ bá wa sọ èso lágbára débi kó wá padà di tí wọ́n ṣe operation torí ẹ̀.
It can lead to so many things, complications, heart attack, stroke, and okay, àwọn SARS parí tó kùn death. So, yeah.
Náà jazakumullahu khair. Náà nínú àwọn ìbéèrè tó wà ń bí wọ́n ní ọ̀nà wo ni a lè gbà tírìtì ọ́sà láì lo oògùn. Ẹlòmíì tí wọ́n béèrè pé ẹjọ́ irú oògùn wo làwọn lè máa lò fún ọ́sà. Two different questions ni.
Well, I will combine the two.
Yes, sir.
The first treatment for ulcer is you eat and eat and eat. You eat when you wake up in the morning, even when you teba tají lóru, you have to take something. Hello? Ó jẹ́ any problem ulcer. What is that ulcer tá à ń sọ? Ọgbẹ́ tó wà nínú intestine ẹ̀. Tó bá jẹ́ pé ìta ló wà, ó máa easy láti jìnnà. But kí ló máa ń fà tó fi ní pains tó ní? Because the secretion tó wọ́n jẹ tó máa digest oúnjẹ tí ó bá ti sí nǹkan tó máa digest is like ọsàn wẹ́wẹ́, omi ọsàn wẹ́wẹ́ tó bá fún omi ọsàn wẹ́wẹ́ sínú ojú egbò. That's the way you are feeling. So but when you are eating oúnjẹ yẹn tẹ́ ń jẹ díẹ̀. So at any point in time ó ní nǹkan tí ó máa digest, so ó máa jẹ́ kó tètè heal. Oúnjẹ ulcer ẹni tó bá ní ulcer, you eat very early, in between meal ẹ mọ̀ pé oúnjẹ mẹ́ta ni wọ́n ti condition mind wa, oúnjẹ àárọ̀, oúnjẹ ọ̀sán, alẹ́, àbí? But as an ulcer patient, it's not 3 times. When you wake up in the morning, you break that fast. Between breakfast and lunch, you take something. Between lunch and dinner, you take something. When you wake up by 12, you take something. I'm not saying you should eat big pounded yam àbí àmàlà. But oúnjẹ tó fẹ́ jẹ lẹ́ẹ̀mẹ́ta, normal ẹ̀mẹ́ta lójúmọ́ yẹn, you can divide it into 5 times. Are you getting my point? Tẹ́ bá tẹ wá lóúnjẹ yẹn, this sachet Milo àbáwọn kìíní yẹn, you can just put or 1 or 2 slices of bread or 1 or pieces of biscuit. Or if you don't have any at all, you can get Jelil. You know that tablet Miss Maggie. You can have it when you wake up. Just put it, lick it.
tó bá ti jí láàárọ̀ tó tí nìkan jẹ lick one you prepare your food after that so with that tó bá lè ṣe bẹ́ẹ̀ for about 6 months ulcer yẹn máa heal then there are drugs too you can call me I will tell you about the drugs you take those drugs for 1 week after that then you continue to eat like that ó máa jẹun ṣẹkẹṣẹ wọn máa bú ẹ pé akílódé ò ṣe jẹun tán ní so tún jẹun in fact kó jógì ló fẹsẹ̀ mu díẹ̀ ògì yẹn ó tún rọ síbi ó tún pẹ́ díẹ̀ ó tún mu díẹ̀ so at least at a point in time there is something in your stomach so it will heal.
naam
inshallah.
jazakumullah khair. wọ́n ní ẹjọ́ ṣé ó dáa kí èèyàn máa lo oògùn fún menstrual pain àti pé kí ni èèyàn lè ṣe láti prevent infection.
hygiene ni.
Oh.
You must be you clean your environment take care of yourself so ìyẹn lọ then menstrual pain ẹ bá rẹni tí pains yẹn serious ó need something to suppress the pain o kò wà palatable o but is that for about 3 to 5 days so you take that you know some have that serious menstrual pain that some women will be rolling on the floor like this rárò pé kìíní ni so it's advisable to use something but get expert advice. Totan.
naam wọ́n ní lẹ́ẹ̀kan mention pé tí ẹ bá ń jẹ ọ̀rá tó pọ̀ pé ó súnmọ́ kó dí pipe tó wà nínú pé ọ̀nà olè àwọn lè máa gbà láti máa through pipe yẹn
ẹ má jọra púpọ̀ well no to do that please well there is what we call lipid profile hello there is a test called lipid profile when you do the test only value range tó bá ti kọjá normal you know and they can give you drug to clear it are you getting my point so you can do test so let me do lipid profile and see ṣọ́ra pọ̀ lára mi àbí ọ̀rá pọ̀ but irony of life is ẹ lè rò pé ẹni tó sanra gan ọmọ alọ́ra tó pọ̀ o kẹ́ni tó sanra tó èmi báyìí tó tún ṣe jù báyìí lọ́kàn náà kò lè sanra lára ẹ that's not kò pọ̀ sí kò lọ bẹ́ẹ̀ yẹn o so ẹni tí ò lára rárá ó lè ní ọ̀rá tó pọ̀ ju ẹni tó lára lọ o so ó lè jẹ́ omi ni ó pọ̀ lára ẹni tẹ́ ń wò pé ọ̀rá pọ̀ lára o torí mo mọ̀ pé àwọn brothers máa sọ pé èmi bí mo ṣe smart tó tí mo ṣe àkósọ́ra lára mi go and do test no dey show for face o.
oníbèrè béèrè pé àwọn tí àwọn bá ti fall sick pé wọ́n bá recommend oògùn fáwọn bóyá wọ́n ní káwọn lò bí ẹ̀mẹrin abẹ́ jù bẹ́ẹ̀ lọ wọ́n tàbí ti lo ẹyọ kan ara wọn máa ń yá pé àwọn òdẹ̀ kì í lò mọ́ pé ṣé ó dáa bẹ́ẹ̀ bí báwo ni káwọn ṣe ṣe.
thank you so much sibara sir kò dáa rárá àwa tí a kúnnú àwọn tó máa ń ba oògùn jẹ́ nìyẹn because there is what they call drug resistance tá a bá rántí pé tá a bá treat malaria tẹ́lẹ̀ chloroquine la máa ń lò so ó dé stage kan wọ́n ní chloroquine ò ṣiṣẹ́ mọ́ irú ẹni tó lo oògùn lẹ́ẹ̀kan tí ò lò mọ́ yẹn àwọn tó contribute sí that resistance nìyẹn it's not as if the chloroquine kò ṣiṣẹ́ rárá but kò ṣiṣẹ́ tó level tó yẹ kó ṣiṣẹ́ mọ́ because àwọn kan ti abuse ẹ̀ wọn ò lò dáadáa ṣẹ́dẹ̀ mọ̀ pé àwọn mosquito yẹn náà àwọn náà kàn rọ̀gọ̀ so ẹni tó lo ẹyọ kan tó yẹ kó pa àwọn parasite yẹn tí parasite yẹn survive ẹyọ kan yẹn tẹ́ bá lo ẹyọ méjì níjọ́ mi kò ní mu so bóyá wọ́n tún lo méjì gbà tó bá tó lo mẹ́ta so òun ló fà á so by the time táwọn bá rẹ̀ sí bí ọmọ wọ́n á máa bí ọmọ tó jẹ́ strain tí ò ní oògùn yẹn ò ní capture mọ́ the same thing to antibiotics so when you are given antibiotics and you are asked to take it for 3 to 5 days please do even if you are okay take it yes.
now wọ́n ní ẹ̀jẹ̀ irú àwọn oògùn wo ló máa ń fa ọ́sà fún yàn.
well àwọn oògùn tó ń fa ọ́sà pọ̀ kínní if àgbàtẹ́ kó lọ síbi oògùn tó ń fa ọ́sà àìtètè jẹun ká má tètè jẹun dáadáa ó lè fa ọ́sà all these non-steroidal ibuprofen ibucap diclofenac they can cause ulcer aspirin they can cause ulcer which other one
so àwọn oògùn yẹn lè fa ulcer but kó tó fa ulcer that means pé a jẹun dáadáa a lo àwọn oògùn yẹn that oògùn ó wá kọ̀ sí ulcer crater ó ha àwọn sáàdì ibẹ̀ yẹn so nǹkan tó ṣẹlẹ̀ nìyẹn so it's not the oògùn that really cause it it's us that we didn't eat before we take those drugs and now resorted to ulcer.
Now, last question inshallah wọ́n ní ẹjọ́ ẹ bá wọn gba ẹ fún wa ní ìmọ̀ràn lórí àwọn victims báyà àwọn patients tí àwọn doctor àbáwọn nurses máa attend sí tí wọ́n máa ń béèrè oríṣiríṣi àwọn questions lọ́wọ́ wọn pé kí ló dé tẹ̀ tí marry kí ló dé tẹ̀ tí wọ́n question yẹn pọ̀ gan kí ló dé tẹ̀ tí bímọ kí ló ń ṣẹlẹ̀ so wọ́n ní ẹjọ́ lórí nǹkan yìí please enlighten us more on the difference between mockery and showing of concern so mi náà bí ẹn tí ó ń ṣẹlẹ̀ ní kí èèyàn fẹ́ elicit information lọ́wọ́ patient kí wọ́n máa try láti ní history bóyá from the point of àwọn point ẹ̀kẹ́ ni wọ́n máa cancel ẹ̀ pé
well Allah you know in the medical profession or any other profession.
Only the judge and talk around about the people's problem.
Hello.
Lack of confidentiality.
Well, let me start from that last statement. Confidentiality is synonymous to medical practice. Hello. Confidentiality. Tèmi àti wọn bá sọ̀rọ̀ tí ìyàwó wọn bá dé mi ò ní right àti sọ nǹkan tèmi àti wọn sọ fún ìyàwó wọn except if he permit me and it has to be in his presence. Are you getting my point? But what I can say from a question here is that because ṣé mo pé téèyàn bá ní problem and by the time they talk about it you look at it as if pé bóyá ó ń fìyàn ṣe yẹ̀yẹ́ ni. Hello, it is not. When you go for treatment any routine questions tá a máa ń béèrè and part of it is family history menstrual history gynecological history obstetrological history so by the time you are asking so tí àwọn questions àwọn answers ẹ fún wọn tó bá ní nǹkan tó wà questionable they want to probe we are not God then ṣe àwọn yes okay nǹkan báyìí ló ń ṣe ẹ́ no it is the history àwọn nǹkan tẹ́ bá sọ yẹn la máa tie together I will now see that okay the problem is likely to be this and this but because nǹkan tó ń dùn ènìyàn yẹn lọ́kàn ni so it will seem as if bóyá wọ́n fi ṣẹlẹ́yà ẹ ti understand you have your right to say doctor don't go there that's not why I'm here hello tí o bá jẹ́ nǹkan tẹ́ bá lọ nìyẹn ẹni tó máa béèrè obstetric ọmọ mélòó lẹ ti bí doctor máa wọrí ẹ máa lọ bẹ̀ yẹn kì í ṣe nǹkan tí mo bá wá nǹkan tó ń ṣe mí ni orí ló ń fọ́ mi àti inú ló ń run mí ẹ̀dọ̀ ló ń dùn mí ṣé you understand because the person will want to tie everything because orí tó ń fọ́ yín yẹn could be as a result of bóyá ẹ̀ tí lọ́kọ bóyá ẹ̀ tí bímọ bóyá you are thinking about it because by the time you just treat your headache the headache will not go but you want to get to the root of that problem and see that because ẹ̀ tí fọkọ ẹ̀ tí níyàwó ẹ̀ tí lọ́kọ ẹ̀ tí bímọ ẹ̀ ń wá ọmọ ẹ̀ ń ronú ọmọ but that's the problem because maybe that solution òun ló máa mú kí orí yẹn lọ that's the way we work we probe further ask questions so ask so ẹ má wò pé bóyá wọ́n fi ń ṣe yẹ̀yẹ́ àbí kìíní kan but if you know that where he's going is not an area you want just tell that person that don't go there.
Jazakumullahu khairan.